Excellent. Thank you so much. This is our last rapid round community conversation. And we're going to step up to the global discussion on connecting the dots, local action to drive global progress for SRHR. Welcome, Aminu Garba, who is the global co-convener of COPASAH and also the head of the Africa Health Budget Network in Nigeria. Also, I want to welcome Emelyne Calimoutou, who is the Senior Legal and Gender Specialist with the Global Financing Facility Secretariat. And last but not least, Jacqueline Mahon, who's the Principal Advisor for International Development Finance at the United Nations Population Fund, known as UNFPA. Welcome so much. Thanks for joining us. So our panelists today are going to talk about the power of collective voice and why it's so important that civil society advocacy not be fragmented, but rather bolstered, and how this effort really supports some of these big global initiatives and global commitments that we're looking at for the health and well-being of communities around the world. So let's just get started. Each of you, if you could talk a little bit about the mandate of your organization. And perhaps we can start with Jacqueline, then go to Emelyne, and then Aminu.
Thank you, and good morning, good afternoon, good evening to everybody online. It's lovely to be here. Thank you, Nabeeha, and many congratulations to you and PAI on the launch of your new strategic plan. And it's so lovely to have had the opportunity to listen in, to hear from colleagues across the globe on the many developments and achievements. So many congratulations. So as you said, UNFPA, UN is the Sexual and Reproductive Health Agency, delivering a world where every pregnancy is wanted, every childbirth is safe, and yet every young person's potential is fulfilled. We have committed to 3 transformative results as an agency, to hold ourselves accountable, to deliver 0 unmet need for family planning, 0 preventable maternal deaths, and 0 gender-based violence and harmful practices. And we are active in over 150 countries, working both on the development and the humanitarian side. Thank you very much.
Emelyne, over to you.
Thank you, Nabeeha, and congratulations to the PAI team for this great event today. The Global Financing Facility for Women, Children and Adolescents is a multi-stakeholder global partnership located at the World Bank and committed to ensure all women, children and adolescents can strive and survive. Launched in July 2015, the GFF supports 36 low and lower middle income countries with catalytic financing and technical assistance to develop and implement prioritized national health plan to scale up access to affordable quality care for women, children, and adolescents.
Aminu, over to you. I hope you can hear us.
Okay, thank you very much, Nabeeha. Let me PAI for launching the 5-year exciting plan, and I will look forward to support the implementation. So briefly, I'm based in Abuja, Nigeria, and the COPASAH is the community of practitioners on accountability and social action in health, with a global secretariat at the Africa Health Budget Network in Abuja, Nigeria. COPASAH is a global South network actively engaged in promoting accountability and transforming health system towards the achieving the social justice, with a mission to nurture, strengthen, and promote collective knowledge, skills, and capacity of community-oriented organizations and health activists. We are primarily in Africa, Asia, and Latin America, working in the field of accountability and social action in health for promoting active mobilization and engagement with government, donor partners, and all different stakeholders to ensure health system responsive, equitable, and people-centered accountability for health. And also, we have also an accountability. We have an accountability charter also that was launched in 2019 at the Global Symposium for Accountability, a very ambitious, robust accountability charter that is defining the different roles of advocates and accountability and transparency at the Global South. Thank you very much.
Thank you so much. So another question for all of you, and you know, when I kicked off my remarks for the strategic plan, we acknowledge and I acknowledge some of the challenges and barriers that our sector still faces. And I think we have to acknowledge that our sector is under threat. The health and well-being of women and young people at risk communities under threat. And I'd love to hear from your vantage point, from your organization's vantage point, what threats do you see on the horizon that will really get in the way of our ability to achieve universal access to sexual and reproductive health and rights for all? Emelyne, maybe you could go, and then Aminu, and then Jacqueline.
Sure, thank you. Sexual and reproductive health and rights are restricted in many parts of the world, limiting progress towards achieving gender equality. Laws, financial barriers, limited resources due to the COVID pandemic reduce the quality, access, and use of SRHR services. All of this stand in the way of women and girls' ability to access the healthcare and resources they need to strive. When a woman lacks sexual education, access to family planning, and the right to live free of violence and autonomy over her own body, she misses out the opportunity to receive an education, work, and enjoy her life. Thank you.
Should I go?
Yes, Aminu, go ahead. And then Jacqueline will go after you.
So thank you very much for this very important question. Let me build from the Emelyne conversation. She already mentioned the COVID-19. So at the Global South, the COVID-19 is one of the threats, you know, for the work around the SRH. Not only COVID-19, COVID-19 is an example of health security issues at the Global South. So the COVID-19 and so many other health security challenges, from Ebola, from the Lassa fever, from cholera, from so many other outbreaks of diseases, they are biggest threats in the Global South, because when we have those outbreaks, they are disrupting the SRH services in the Global South. So because of the outbreaks, a lot of women will not be able to go to access antenatal care. A lot of young people will not be able to access family planning services. They will not be able to access adolescent and youth-friendly services. And also at the same time, a lot of primary healthcare centers, they have to shut down. So that is, you know, a big threat to work. And also at the same time, laws and regulations in some global South countries, they are also restrictive to SRH. That's also a big threat to the services. Some laws are very difficult to navigate in terms of accessing services. Some are not flexible. Even when there are laws, they are also difficult to implement. So then the issue of challenges with funding. So funding is not only from the donors, also funding from the countries, the Global South countries. There's a lot of dwindling financial resources at the country level. There is no innovative health financing to galvanize, you know, funding for SRH and R, also in the Global South. Because of the COVID and the outbreaks, a lot of funding have to be diverted to so many other health security issues, and because of that, it's a threat to the services. Then the last threat I want to mention, the shrinking space for the Global South civil society organizations to deliver to advocate, to promote accountability and transparency, there's a shrinking space in the land. So many countries, even in democracy, where the government is democratically elected, you find that the space for civil society to do the job, there's also shrinking because of the challenges of laws and regulation, dwindling funding, lack of understanding of the government official to allow CSO to advocate for the SRH services have also been a threat. So definitely we need to promote shifting power, sharing power, and convening power with this Global South CSO to address threats of the services. Thank you very much.
I will follow on. One of the nice things coming last is that many of the points that one would like to raise have already been raised. So thank you so very much. I wanted to prep my answer and my response to first say that in 2019, and in October 2019, we had the 25 years of ICPD, and we had the Nairobi Summit, and we had countries, we had governments, we had civil society, we had the private sector, communities all coming together to make commitments to scale up efforts to realize the ICPD agenda, including universal access to sexual and reproductive health and rights. And sadly, when we look at, the developments now, and we recently had the progress report from the high-level commission, and they highlighted the harrowing setback in SRH, including the fragility of rights and glaring inequities. And I just want to put them there as very much center. The panelists have also highlighted the COVID-19, and that's something that we are watching and monitoring and engage very closely, because of the potential to derail decades of progress in advancing sexual and reproductive health and rights more generally, particularly for women and girls, and very much in low and middle income countries. And what we have seen during the onset of the pandemic, for example, access to contraceptive services, for example, were very much disrupted because of the pandemic and the ability to deliver healthcare services. So we estimated at UNFPA that in the first 12 months of the pandemic, it may have led to as many as 1.4 million unintended pregnancies. The other area, of course, is the humanitarian crisis, the increasing humanitarian crisis that we are seeing around the globe. The war in Ukraine, ongoing humanitarian crises in Yemen, in Afghanistan, in Syria, and elsewhere. We're seeing, substantial impact on the ability for women and girls to access sexual and reproductive health services. We know, for example, the maternal mortality is, the significant mortality rates in fragile and humanitarian countries. The climate change, of course, recently we've seen the floods in South Africa, we've seen cyclones in the Philippines, also impacting on the ability to both deliver sexual and reproductive health services and to access sexual and reproductive health services. With the ongoing results and the impact of the COVID-19 on the broader global economic challenges, including rising food and energy prices, further impacted because of the Ukraine war. We're also seeing rising debt in many countries, particularly in low and middle income countries. And this is impacting on their fiscal space and their ability to be able to fund more broadly their priorities, including sexual and reproductive health and rights. And again, as highlighted, the international funding of sexual and reproductive health and rights, we are seeing reductions in the funding of sexual and reproductive health and rights. Thanks so much.
Well, let's stay with you, Jacqueline, about this backdrop and this concerning reality that we are facing. For UNFPA and therefore so many others to do the work and achieve your mission, it's important, of course, that governments pay their fair share. Certainly for PAI, one of our US advocacy pillars is to ensure that the US contributes and contributes at an increasing level to UNFPA, but there's a big task ahead. And I'd love your thoughts in terms of the role of civil society organizations like PAI, like our partners, many, many more. What else do we need to do? Where should we step up that you think could make a big difference?
No, thank you so much. And let me first say that we are very grateful to PAI for its long-standing partnership with UNFPA and in leading the International Family Planning Coalition, and in its consistent use of fair share messaging to ensure the support of global sexual and reproductive health. And we further appreciate the inclusion of dedicated funding to UNFPA, whether it's increased funding or specific policy developments that will facilitate a stronger and strategic partnership with governments, including the United States government. And in this way, civil society plays an indispensable role in amplifying the voices of those whom we all serve on this call, to policymakers in Washington and in other capitals across the globe, and in UN fora. At the moment, we have the Commission on Population and Development, the 55th session, and it's so important to be amplifying those voices in the importance and centrality of sexual and reproductive health and rights. And I think it's so important to continue to be so proactive, and particularly the challenges that we are confronting as an SRH community, bringing the voices of those we serve front and center, and the difference that funding and policy and engagement and at the highest level can make in the life of woman and girl. And UNFPA as a global organization with a high degree of decentralization, I mentioned that we are in more than 150 countries. We continue to work towards a global world of zero preventable maternal deaths, zero unmet need for family planning, zero gender-based violence and harmful practices. And civil society and all of you on this call play a huge role alongside our member states in helping shape UNFPA's work. And we're grateful for the activism, the partnership, and even the criticism. And that's so important to keeping us and keeping our mandate aligned with the needs of those we serve. Thanks very much.
Thank you, Jacqueline. And at times when PAI does have to be a critic, it's always evidence informed. And also appreciate the receptivity to hearing from us always. To you, Emelyne, on GFF, of course, there's a great task ahead for the GFF as you look at advancing the gains that really affect the health and well-being of women, children, and newborns. Of course, your commitments come from governments, but many, many more. I'm curious if you could highlight why do CSOs matter in the GFF commitments? Same kind of question as Jacqueline, what's the role of civil society and what heft and contributions do they bring to achieving the GFF's aspirations?
Thank you, Nabeeha. First, I would like to say that civil society, youth and communities have been very important partners since the outset of the GFF. In the GFF process, they are the one ensuring that national strategy are evidence-based, reflective of community needs, and aligned with the other related policies and strategy. CSO can help reaching population most left behind and can support with demand generation for services. And CSOs drive accountability by monitoring implementation, services quality, and funding flows. And to share a bit an example of how we are partnering with CSO, I would like to share the example of the work we are doing on legal reform on SRHR and gender. The GFF have been providing technical assistance to the government of Niger to reform its legal framework to allow married adolescent girls to access family planning without being accompanied by their parents or husband. And more recently, to reduce unwanted pregnancies, the GFF also supported the right for secondary school girls to be allowed to access school health clubs to receive comprehensive reproductive health classes, offering objective information and scientific knowledge about adolescent reproductive health. Reforming laws and regulation are a long-term process that requires coordination with all partners and building coalition that drive broad-based approach. While government's commitment is a key driver of reforms, other stakeholders such as civil society organization, local women's group, and the private sector are also strong advocates for change. And the GFF is also providing technical assistance to the government to work on the implementation of this reform. And CSO are key partners, especially women lawyers organization in Africa, who are playing a crucial role in designing and implementing complementary activities to legal reform on SRHR, including community mobilization, legal awareness, and legal literacy campaign around this law and regulation. These activities are really crucial to make sure that the most vulnerable communities are aware of their rights. Thank you.
Thank you, Emelyne. And Aminu, over to you. Given your leadership role on COPASAH, it's an incredible Global South network of civil society advocates reaching across Asia, Africa, Latin America, and the Caribbean. I'm curious from your perspective, I mean, you highlight some of the things of the threats underway with Global South, CSO networks, and civil society voices. What's really critical and maybe unique of what a network such as COPASAH brings to the table as we advance SRHR globally?
Thank you very much for this question also. Let me speak without the video so that the signal will be stronger. So
absolutely, it's fine.
Yeah, thank you. So the SRHR issues, they are global. At the same time, they are local issues. So we are discussing a global launching, but the problems of the SRHR, they are local issues at country level. And from all the statistics we have been reading from WHO and so many other reports of the UNFPA, GFF, and everywhere, the global South countries, developing countries, they have more of these problems around the SRHR. So for example, the issue of family planning, the unmet need for family planning, access to commodities, services to do with adolescent young people. There are a lot of challenges more in the global South than the global North. Because of that, this is the value of the significance of the global South networks. They are closer to the people. They understand the local context of the problem. They can engage the government directly. So an international partner will find it difficult to engage Nigerian government or Cameroon or Tanzania directly to do advocacy. But because we are in the global South, we have the legitimacy. It's our country. So we can engage easily and hold the government to account. We can also collect local data from the community and the grassroots. That is the community practitioners' accountability. We can bring information from the community to the grassroots, to the national level, to regional and the global level. That is the value of the global South, networks of organization. And at the same time, we can also develop scope, the motion tracker, my brother mentioned from Uganda, the scorecard on accountability, the access to information, all these components of accountability, because we're in the global South, we'll be able to engage better than the international community, who are also very important, but their role is at the global level, and we are at the global South. So these are some of the value add for us to continue to engage structures like COPASAH, so many other global networks to promote the sexual RH and rights services. Thank you very much.
Thank you, Aminu, and we are approaching time. So this last question, although we could have robust more discussions, and I hope we can do that in the future, but 30, 40 seconds each. And this is a question that PAI gets often. I'm sure all of you get it, our partners get it, is what's the return on investment for advocacy? What's the proof that advocacy works and that advocacy is needed to advance sexual and reproductive health? What message should we be giving to those who ask us that question? So again, 30, 40 seconds each of you. And Aminu, will go with you, Jacqueline, and then Emelyne.
Okay, so quickly in 30 seconds, the messages and evidence has shown that advocacy has led to increasing funding for family planning communities at the global south level. For example, COPASAH works in India, in Peru, Guatemala, Macedonia, African countries. It has shown that advocacy has led to budget allocation, more money for health, and also more health for the money. This is also one example. Another message that I also want to communicate is that the advocacy has led to strengthening the role of parliamentarians to hold the government to account, to also provide oversight function of the National Assembly at country level. Another value that has shown also the more we do advocacy, the more we strengthen the multi-stakeholder and multi-sectoral accountability mechanism at the country level to promote dialogue and also access to information. So indeed, there's a return on investment for advocacy, and I want to urge the donors to continue funding advocacy. Thank you very much.
Couldn't agree more with Aminu. And I'll just prep it, but advocacy work does not always result in an immediate dividends, but it's clear that consistent engagement and advocacy does ultimately matter. And we saw that with the COVID-19 response, the advocacy to ensure that SRH was part of that response and included in that response. And I've just come from Tanzania. I was the UNFPA representative in Tanzania, and I saw the power of advocacy. And Aminu talked about networks, civil society networks, and the tremendous work that they're doing in the area of ending child marriage, ending female genital mutilation, and the success in ensuring that pregnant girls could continue in school. So thank you very much. It is powerful. It is a strong return on investment.
So I will finish this round of questions by saying also that advocacy work takes time. So it's important for donors to know that. Many of this change takes time, and it's a message for those who are looking to see a return on investment. Advocacy and accountability go through timely processes and to demonstrate change in policies, budget, and accountability. We cannot expect to see the impact of advocacy within the 1 year of funding. Long-term investment is critical, and sometimes advocates need to adjust, adapt, and start all over again, particularly in unstable political environment. This is why it's important to work with communities, have a bottom-up approach to ensure that they understand their role in advocacy and engage with decision makers at the local level. Thank you.
Thank you so much to all of you, and more to come on this. We are going to conclude our 2-hour conversation today. I want to thank our esteemed panelists, our board member, Angela Bruce Rayburn, all of you for bringing your frontline view of the power of advocacy and the SRHR wins that have been achieved. These 3 short conversations, these community conversations, really reinforce, I hope, for everyone, the importance of sustaining our US and global level advocacy, the power and the impact of country level efforts that improve outcomes, not only at country level, but ultimately outcomes at national, regional, and global levels. And these actions really drive access. And the third, this last conversation around a perspective from global institutions and global networks that have lifted up the important role that civil society-led advocacy has on driving demand for SRH services and ensuring that commitments are attained. Sometimes holding government accountable, other times working side by side with them, but more often than not doing both. I appreciate that you all joined us today, and that we could have this conversation together. And that as we deliver on PAI's next era, know that we move forward with courage, strength, inclusion, and kindness. We're also moving forward with the knowledge that each of you is with us, and I hope you know that we are with you. Thank you so much again. And over to you, Sarah.